Good afternoon, everyone. My name is Lori Banales, and I have the privilege of being the Executive Director at Alta California Regional Center here in the state capital and 9 surrounding counties as well as Sacramento. So it's a huge task, but I take it on with a lot of well, I know it's a huge responsibility, but I've been working here for 27 years, and I feel like I have a pretty good lay of the land and an understanding of what is needed for our community. But with that, one of the opportunities that I had to present when I was going through the selection process was, my vision for our regional center. So I've been here for 27 years. I've been involved in a lot of great initiatives and activities and great outcomes for our client community. But what did I want to see going forward? And of course, we're in the middle of a pandemic, so there's all the overlay with that. But I was really interested in making certain that we had an inclusive community. Meaning that we reach out to our stakeholder partners regularly. Our stakeholder partners being our clients and their families, our providers, the advocates, our staff, anybody and everybody who's interested in making the regional center a great place to be. I want ownership of the regional center to go beyond those individuals that work here. I want the ownership and the commitment to the regional center being a great place to serve clients with developmental disabilities, to be owned and understood by everybody. So that's the vision that I have, and that's the platform that I bring forward, and love this opportunity to come and talk with all of you today. And when I say talk with, I mean that. I don't want to just talk to people. I want to have discussions. I want to have my ears open to the ideas, perspectives that you have for our regional center. We have a lot of great things that are currently happening. And that's largely as a result of hearing from you all what's important in areas that you'd like for us to concentrate on. And so some initiatives that we're doing that I think that Jennifer Bloom, who is one of our associate directors, I know she spends time at this meeting with you all monthly. She has a great deal of energy and commitment to the regional center, and she is leading us in one of our initiatives around employment, and that's the competitive integrated employment roadmap initiative, where we have opened the membership to that group for all of the different stakeholders that I had mentioned. We have clients, we have staff that sit in different seats of the house too, not just service coordinators and managers, but we have our cultural diversity specialists, we have our special education inclusion specialists, we've got individuals from DOR, we've got individuals from education, lots of, and providers, of course. That was an oversight actually on our part, and over the last few weeks we've integrated a number of providers that have a great deal of interest in working collectively with the community to bring together training to help support our staff in conversations at all different age junctures along the roadmap, to engage with the Employment First initiative, to get students and education excited about the opportunities to introduce different possibilities for the future for employment for our clients, and to meet them where they're at, and to help to provide the skill set necessary to get them going down that road. So that's one of the initiatives that we're working on, and it's really exciting, and we're really hoping that having it braided into our performance contract, which is one of the documents that were measured on outcomes through the State Department of Developmental Services, which of course we have a contract with to provide services. We want to make sure we're doing really great things to have great outcomes for those measures. And so we've, over the last 2 years, really increased the number of activities. Planned activities is what they're called, to support moving some of these data points forward in the direction that department would like to see them go. Additional to that, we have another initiative which also is comprised of many individuals of the community, much like the CIE initiative, and that is our Coordinated Future Planning Committee, which is really looking at succession planning. On the one hand, it's braided to do a lot of different things, but initially it came out of the need to really get in front of succession planning for our clients that live with aged caregivers. But it's grown beyond that. That's a great place for us to start. But we want to look at having conversations, sometimes difficult ones, with our clients and their family members, the providers that are providing the care to them directly, to look at beyond the circumstances. Where will this individual choose and want to live, and how will they best be supported, and to get those plans documented in the IPP. So when the moment hits, if someone is hospitalized, if a primary caregiver is hospitalized or passes either timely or untimely, we have a document that has a very thoughtful plan in place to support the individual without it being a crisis intervention that we have normally been held to. And with crisis intervention, the limitations of housing present because you're dealing with what's available in the moment. And so we want to look at, where do you want to go? Where do you see yourself? What supports do you need to get there? And be very planful in this process. If resource development is necessary to make sure that the housing options are available, we're working with braiding that back to our resource development department to make sure that we're increasing resources in the communities that people live with the available and type of housing as well. So that's the secondary component of it. We've got family members who are really engaged in this process, who are excited that we're having the conversations now and want to be part of the training with our staff. So that's another element that is a little bit different going forward for our regional center. We're looking at increasing the voices that lead to training for our staff. So we've got parents, we've got advocates, we've got our own staff who are experts in their own rights, and many of our staff have already just organically created these succession plans in the IPPs. It's not pervasive across every plan, but we, in looking at identifying individuals and trying to put a baseline to the number of IPPs we'd like to see have these plans incorporated, we have noticed that there are some really great plans that are currently in place for several of our clients, and we're looking to those staff that have had the opportunity to have conversations with families to be part of the training as well. So we're excited about that. That also is incorporated and braided into our performance contract so that we can see over a series of the next couple of years what the impact is with housing and with allowing for people to remain in their family homes or in a home of another person with that succession component incorporated in. So those are some things that we're working on. Of course, we've got the SDP, the self-determination program that was, I guess the doors were wide open is the best way to put it, July 1. Previous to that, there were a 3-year lead up with regional centers designated certain numbers of slots where individuals were pulled from a lottery of interest from the department. Our regional center had 179 slots. However, we were woefully below achieving bringing that number of people on in that 3-year period. We just didn't have the number of interested parties from that pool. And we've gone back to reflect on reasons why that could have been. But going forward, we're really getting our legs under us. We're getting some momentum. And with that momentum, we're able to create some processes that are supporting transitioning folks. It was a little bit rough at the beginning because we just didn't have that motor memory. We just didn't have the opportunity to learn and apply going forward. But we're doing that now, and again, getting the feedback from our committee, our advisory committee that helps the regional center really to move this along. We get some really honest, candid feedback from the committee, and we are able to take that and implement going forward. So I think we're at about 25 or 26 individuals that have transitioned on, and honestly, that's not a large number, but that's a huge number from where we were 2 and 3 weeks ago. So we're starting to see now it compounding, and the processes are supporting getting people on a little bit more smoothly and more expeditiously. There are still bumps in the road, and there are still ways that we need to monitor and evaluate and implement different processes. But I feel that now that we have the numbers coming forward, we're able to get a better hold of that. And again, been really grateful to our advisory committee because we've been able to receive some really good feedback, again, going back to the community to help us to move along. So those are things that are probably taking up a large part of our time other than COVID. The pandemic, it's been some really trying times, and I know you've all felt that as well. And we've had some peaks and valleys. We've had times where the trends have really upticked, and we've had large numbers of our community affected from positive cases of COVID. We are now looking at workforce shortages across our vineyard community. Regional centers really are no exception to that either. We've had our fair share of individuals that have left as well, and for a variety of different reasons. We've had many people who've just simply retired. We're not going to be able to affect change in that area as far as retention, but we're really concentrating on what are the other reasons people are choosing to leave the regional centers so that we can create more of a stable workforce. And we know that the relationships with service coordinators and clients and families is critically important, and so we're really trying to focus our efforts on that retention, but we also have to look at the recruitment to get people in place. So again, we've created this community of within the organization. So staff from all the different seats in the house. We've got people representing our OAs. We've got people representing our electronic records and file room department. We've got, of course, service coordinators across the different communities that we serve, managers, and our executive team, HR, coming together, really trying to look at innovative ways to recruit, as well as different opportunities that we could affect some change on the retention. So looking at that, but then we had the state mandate that came. So we had the federal mandate that we're still awaiting for the OSHA guidelines on the mandate to vaccinate for employers that had more than 100 employees, which of course our regional center is in that play. We've got 519 employees at this point. And we are constantly just working to get people on, and then people are leaving. So this attrition rate seems to be kind of a baseline, like, bring one on, we lose one. So we're wanting to get ahead of that curve. But now that we have the mandate, we're fearful that additional people will leave. With our regional center, we've been pretty unique across regional centers because our staff rate of vaccination is fairly high. For the longest time, we were at about 82%, and this is well before any mandates. And our regional center never did mandate it, where some of our sister centers mandated vaccine well before the state put that in play. And they had fairly good success, but they also lost a lot of people along the way because we had such a great percentage of staff that were just electing on their own to become vaccinated. I really was just sitting back waiting to see where the state would go. The feds, as I said, came out with their mandate, but before receiving the guidelines on how to implement, of course, the public health order from the California Department of Public Health came forward. And so we have been walking through that. And honestly, this has taken up a great deal of staff time here because it's difficult when you start looking at exemptions and how to apply standards and what types of accommodations do you put in that. And we're in the thick of it right now. And so again, we're 92% vaccinated, so that part's good. But we still have handfuls of people across different sections of the organization that aren't vaccinated and aren't looking to be. And so we're just really trying to get this right. And I've said this in so many arenas, it is really hard to balance public health with choice. And somewhere my light goes off, so I'm not asking for help. I just need to turn my light back on by waving my arms. So we're just really trying to negotiate that middle line, and I'm well aware of my responsibility as the executive director that in the end I have to make a decision, I have to stand behind it, and we're moving through that right now. And I'm just hopeful that we are going to be able to retain the workforce, because like I said, we're behind the 8 ball on the workforce right now, and trying to recruit has been difficult. So again, we are not alone in this. It's across almost every industry out there in terms of getting people in place. But those are the areas right now where we're navigating, negotiating, and trying to make a difference in. It takes up a lot of our time. And honestly, I want to spend more time on client initiatives and moving the regional center forward. But I have to spend an equal amount of time right now on making sure that we have the workforce available so that the clients have service coordinators to support them, as well as working with our providers to make sure that they have the workforce to provide the services that are in IPPs. So it's an important area to concentrate some time right now, and I wish that I had the answers as this plays out come the end of November, but we're trying to put some safety nets in place in the event that service providers particularly have a lower workforce available and aren't able to meet the ratios that are required in order to put services in place. I don't say that to scare people. I say that to just, this is the reality of where we're at. So we're really trying to be innovative on how do we get that safety net of services and supports together in the event that there is a provider of service that one of your loved ones is contracted with that is unable to provide the service at the level in the IPP. So we want to make sure we are able to canvass service providers out there right now to see, we're asking a question rather than, we've gone around the bend on this, like how do we get to where we want to be with the least amount of data that we have to hold and collect. So we started off by saying, well, we wanted to ask providers, how many of your staff are vaccinated currently? How many have plans of action to be vaccinated? And how many are you looking to provide exemptions to? And then in the bottom line, are you going to have a workforce shortage? Those are way too many questions and data points and actually information I don't want to have. So where we landed was, come December 1, how many providers of service will be able to accept new referrals? Then we're going to concentrate on what types of services are there and put together a catalog there. What areas do you serve? So that we have a geography linkage as well. And so we're looking to build that as our safety net, because that's really going to be the bottom line. If somebody isn't able to provide service, then we need to know who could and who could take that person or persons effective December 1. My hope is that we don't have to rely on that at all, but we have to get ahead of it and do our very best to put that safety net together. And so there's some efforts being concentrated there as well. So this is monologue. Is there anybody that had any questions or any areas that you would like for me to talk about?
A raised hand.
Lori, I have a question.
Okay,
this is Abby.
Hello. Go right ahead.
Yes, Lori. So in terms of service coordinator shortage, in which, which age segment would you say is the most, the transition age, or the ages 3 to 18, or the early intervention, the number of service providers?
Okay, so are you talking about for service coordinators for the staff that report to regional centers? So the best way that I could answer that would be, I don't know exactly, but if I'm looking at exemptions that are being requested of us, I do have a breakout, and largely the largest number are within the adolescent adult units, but it's not just concentrated in Sacramento office, for example. They're sprinkled about different offices, but that's the largest number. And I believe there are 14 that fit in that service category. There are 3 that are early intervention that we're negotiating. And I shouldn't say negotiating, we're not negotiating, we're navigating the framework to make decisions based on exemption requests. and accommodation that would follow. And then office assistants, we have 4 that are presenting with exemption. And then I think there was 1 community services specialist, but you know, there's not a lot given the number of individuals that are employed here, but every single person is important because they're hired and they do a job here. So we're seriously considering everything. I cannot tell you the amount of time that I'm spending and devoting to understanding the process, what we're legally required to do. And depending on who I talk to, it's like one thing is one way and another day, another thing needs to be considered, which is contrary to the other. So I just have to take it all in as leader of this organization and make the best decision. And that's where we're at right now. And we're hoping to let our staff know very shortly what the determination is.
One other question regarding the transition. So now we have, let's say, for instance, we have 100 clients who are in need of the transition service and 14 service providers. Now, is there a way where there could be a process change so that the lesser number of service providers can still cater? Because it looks like there is a process. For instance, I'll just share from my own personal, like my son transitioned. He turned 18 in May, and we still do not have a transition coordinator, his earlier coordinator. Now the process is, okay, he needs day programs. Now there is a committee, the service coordinator has to meet the committee, and she has to, and then she gets back to us after 2 weeks, and then again get back to the feedback. So can we consider, I mean, is there a scope for the process to be changed so that we can still cater to the clients with the lesser number of coordinators? I mean,
yeah, so you know, and I appreciate your perspective, and I thank you for the feedback. I do understand that there's been delays. There's been delays with this transition as a result of COVID as well, because they're you know, the types of programs and the opportunities to go and visit programs and different you know, service providers is changed, you know, over these last year and a half. You know, we're hoping, like I said, with vaccinations and coming down, hopefully the other side of this pandemic, that things will open up and there'll be better opportunities. So there's some delay in the process as a result of that. But it shouldn't be 2 weeks here, 2 weeks there, 2 weeks there, and suddenly we've got a month and a half, 2 months that are under our belt and we're not any further along. And so we are looking at that. And I do really encourage you to have conversations with the manager if it's related to a family member of yours, or if you're helping to navigate the system for other family members, you know, getting them to pick up the phone, call the associate director, call the manager, because we can deal with some of those pressure points case by case as well. I don't know.
We have several questions. I have Benita.
I see lots of hands. Okay.
Benita, and then Kidada, and then Nancy, and then Lori. Okay. Perhaps in the chat you could put some contact information if people have follow-up questions to your responses when you have an opportunity. Benita?
Okay.
Thanks, Lori, for coming today. You know, I know you hear a lot of negative things, but I want to tell you something that was really positive that happened in the SDP meeting. You know, Michelle came and reported on a lot of answers that your clients had in a prior meeting that I thought was very successful. It was very in detailed, and it was very appreciated. I got a lot of feedback in regards to that part of what she shared, which I think is part of what the committee can appreciate, is that when we have our SDP committee, is that, you know, we want to hear from the community, not just the members, you know. So I wanted to let you know that was a very positive thing that happened. We really appreciate it. And I hope that she can continue to take the some of the questions that we have and concerns and kind of come back with that, because I will tell you, it was very appreciated from a lot of community members and the public. So I wanted you to know that.
That warms my heart, and I know that she'll be really satisfied to hear that as well. She's, you know, Michelle is well, like all of my staff, honestly, but Michelle, she's just such a trooper. She just wants to do the right thing. She wants to hear what you're saying, and she wants to be able to provide that feedback. So it'll be really meaningful for me to share that you had some positive regard around that.
Yeah, so thank her for that. My other thought was that when you spoke about the aging and what you guys are doing in regard to aging and succession plan, and it's just the kind of thought to think about someone who is a single mom, and even though we were in COVID, so there's no age to when people could pass away and what have you, right? So,
absolutely.
my
Go ahead. I'm sorry. I don't mean to cut you
I
off.
was thinking that my thought was that, is it possible? I know that you've dealt with ones whose parents are older in their 60s and 70s, but I will tell you, as a parent who has been doing it for a long, I would like to see this happen prior to me dying. I know it would create great peace for me to know that my loved one would be okay, and that not would I happen to get sick or get hospitalized and trust strangers in a system. No effect to Alta Regional, whatever, but I would hope that you guys would take it to a little bit further. There's things that could help to be in place and service-wise, or with why they're yet still young, because death has no sense of age, if you know what I mean.
Understood. So when I had said that this has kind of grown beyond that, it started with a really concerted effort of, so for data points, we looked at identifying clients that were 52 or older that lived with a family member. That's kind of was our baseline, because we assumed that family members, if they lived with a family member, would be in their 70s then typically, for a client that was 52. We started very honestly just identifying that group of individuals. I think there were about, gosh, I'm getting my data points all mixed up. There was either 283 or 500 and some. Nonetheless, we have an identified number, and we track that in our performance contract, because we need to kind of have something that we're gauging effectiveness against, and we're concentrating there. But we realized very, very quickly thereafter that just the point you're bringing. So Jen had brought forward, and she goes, I need to let you know, I have a lot of conversations with grandparents that are care providers for young children. So it's not just 52 and older, but there are these situations. And then that started to grow. We really do need to have these conversations at every IPP across every age, so that family members have the opportunity to provide the feedback and give the service corps and the regional center the opportunity to develop resources to put in training and supports, so that we're working towards making certain that the individual would be cared for in the way that the family member for minors desires for them to be, having those conversations, but also that we're not just limiting it to those that are older. And so we are incorporating the training to be at every age and stage, so that those conversations are more natural, really normalizing the conversation about succession planning for whatever age. So I do appreciate you recognizing that, and we absolutely are right there with you. And we're going to make sure that that training happens. As far as the data on the performance contract, though, we specified that age so that we could wrap our arms around it and track that data.
Got it. Thank you so much.
Oh, absolutely.
Dada?
Kadada. Is she there? I'm trying to find on my
She-
screen.
Brandy, I messaged you. You can go to Nancy.
Okay, Nancy?
Okay. Hi, Nancy.
Yes. My question is, how's it gonna take for service coordinators that's already been vaccinated and clients that's already been vaccinated? How will they start coming into the homes and doing IPPs?
Okay, well, that's a great question, Nancy. And the time is now. If the client or family member is requesting for that to happen, it can certainly happen.
This is me, because I'm a client and I have a service coordinator, it's Lorena Moya. And we had to do our IPP over Zoom, being with COVID and everything. Because
Sure.
my birthday won't be until March. I think I have a chance to have her come to my house to do my IPP.
Yeah. So this is a great question. And honestly, the legislature had thought about it too. So in the budget, they really did understand that there's value to having the Zoom go forward for IPPs as well as for IFSPs, the individual family service plans for our early start kiddos. But what they were really careful in keeping that as an option, it is at the request of the client or family to have the Zoom. If you're not requesting for that, then you can request to have the meeting in your home. Again, yeah, so yeah, do that. And I know that Lorena has, she's been one of the service coordinators very early on that had been knocking on my door saying, I want to go out. Yeah.
She's awesome.
Yeah.
And I have on my IPP, what I've requested is to get an ILS worker to work with me in my home, like to give a break on my mom's, in my mom part, to have them take me to my doctors or take me to like compare shopping, like grocery shopping, cheapest prices, what's nutritional value, what I could shop for.
Yeah, so those are all things that you can certainly talk to her about in person if that is your choice. And I really encourage you to do that.
We do Zoom. We do Zoom every now and then. Like we pick a day if we want to Zoom, so that we just discuss what I need help on, and things that I want to do. Is my goal is to learn how to drive. That is one part of my goal, is to learn how to drive, and how to do that, I don't know. If they have other opportunities, resources, like somebody come in and help me study the handbook, or
there's a lot of steps to it, isn't there? Well, I say engage with Lorena because she is ready to get out there. Like I said, she's been chomping at the bit. She wants out. She wants to get in. She wants to see people. She wants to go and visit. And there have been opportunities way early on where she was just completely masked and covered and gowned, and she went out there and she delivered things. She would knock on the door and leave things, and then run back to the sidewalk and have conversations from far away. She just really felt the need to be out there. And
I think I'm ready for next year for her to come to my house.
All right. Well, you have that conversation. Okay. All right, thank you, Nancy. There are lots of hands. Do you want me to call them or is somebody else calling them?
I got it. Sonia, were you before Karen? I think you were.
I think so. I'll be fast. I just want to thank you, Lori, for taking the time to be here. You're welcome anytime. We love having Jennifer and other of your staff who come, and we really appreciate their input, their updates all the time, and also just being available. In the last 12 to 24 months, the access that family members have had and self-advocates to staff at Alta has increased dramatically, and I think it's just helped information and access and getting people's services and their needs known and met. And when not, you guys have been really open to hearing that. And so I just want to thank you so much. And I will pass it over to the next person.
Thank you, Sonia. I appreciate that.
Yeah.
Joyce, you're up.
Okay.
Hi, Joyce. Oh my gosh. It's good to see you.
I know. Good to see you too. I just wanted to say, I'm so excited to know that there is a coordinated task force, a coordinated futures planning task force with the, of course, a focus on succession planning and other important components. And I know that with your leadership, your dynamic leadership, that, as that program evolves, by the time all of us may need it, or any of us may need it, the services will be there. And I commend you for having this particular task force. I think it's critical.
We hear you. It doesn't feel good to anybody to be in a crisis moment when somebody is not able to remain in their home because their caregiver is no longer available to provide that care. We want to be better at this, and the only way we can do that is to have the conversation. So I appreciate everybody being willing and open to have these conversations at the planning team so that we can get going and not have to worry or think about it. Just know that it's already been identified, fully vetted, and that we have the resources there. So that's our goal.
Right. Thank you. And I know you're going to keep up. Just take care
Don't overdo.
I'll do my best. Yeah, I don't do this alone. Honestly, there's so many people around that that are holding it all together. So I'm really grateful.
Thanks again.
Karen, you're up.
Hi, Lori.
Hi, Karen.
I just wanted, if I can get the frog out of my throat, I just wanted to follow up on Benita's comments and the comments of others to say, all this evidence of collaboration that is happening now at Alta in multiple ways. It's the coordinated task force, it's the SDAC. I've seen it in the SDAC provider group that's putting together the training providers. It's just really been phenomenal to see how people have become really engaged because of that collaborative attitude and how innovation comes out of that.
Yeah.
And I think we've all realized, we've got a lot of systemic problems that are not easy to solve, but that is just such a strong foundation.
Yeah.
It's really encouraging to see, and just thank you for supporting that at the regional center, because we're seeing it in multiple areas.
Yeah, well, thank you, Karen. I mean, it's really not rocket science. Like, we're better together. Everybody has their perspective, what's important to them, the experiences that they have that they bring to the table. To focus it only on the perspective from my staff, I mean, it's important, but it's just one spoke in the wheel, right? We need all of the different participants to bring forward. And you said the word synergy and innovation, because when we have these conversations and we band together, when we recognize that, well, here's an issue and we want to collectively, define it from our perspectives and then add to solutions that can move us forward. I just feel like we're capitalizing on the momentum that's out there, the energy that's out there, the perspectives. I mean, we have to just leverage that into getting some really great outcomes. And again, when you have the buy-in, if that's the right way to put this, the collaboration, the support, the partnership, whatever word you want to put in there, across all these different entities, then everybody's vested in making it work. And I would, any day of the week, I will put my money behind a team of individuals rather than just one perspective. It's a smarter way to work, and we're not having to guess what people want. Let's just ask and see how we can get it done. And like I said, we're seeing it happen like you are, and it feels really good. We'll take our knocks because we don't get things right every time that we go out there to bring something forward. We recognize we're going to have some missteps. We're okay with that if you're okay with that, because we don't do things on purpose, but we're not ever going to get ahead unless we take some risks, and they're calculated. We're not just abandoning all good sense, but sometimes it's just not going to be the right way. But we'll come back and we'll reset, and then we'll go back out again. But when we have everybody's buy-in and participation and perspectives, there's less opportunities to have those missteps, because I think we're being able to navigate and mitigate opportunities where things would fail. But I appreciate that you feel it, because I do too.
All right. Any other questions for Lori? If not, I have a couple of comments.
Okay, please.
So my adult daughter is a regional center client as well.
All
And
right.
I do want to also share a compliment on his ability to pivot. She is enrolled at American River College in a program that started meeting partially in person recently at the beginning of October. So that was a pretty quick pivot on the part of her service coordinator to get transportation in place in the midstream, so to speak. Normally we're planning ahead of time, and so kudos to him and your transportation department for making that happen. It is still a challenge, however, because there's still COVID, and so fortunately we are able to communicate quickly with all of the parties involved, because class was put in quarantine because somebody tested positive, so she didn't need transportation this week, which I'm sure is frustrating for everybody all the way around. But so kudos to him and your team on that part. It's good information to have that meetings in person are available now. I don't think that's something that was necessarily communicated to us. That's helpful, and I do see where staffing and other agencies is definitely impacting the regional center's ability to move forward on things that are in a plan. For example, we were hoping for some navigation training on public transportation, and it doesn't look like RT has anybody in place for that right now. But with the bus driver shortage, obviously, you know, their priorities are going to be on getting those buses out there. But yeah, for the most part, I think, you know, the regional center has been, again, pivoting well with the conditions. And unfortunately, the vendors aren't necessarily in the same position because of staffing. And our service coordinator is looking for solutions, though, to keep those services coming, if it happens to be with a different vendor. So I appreciate your time and presentation today.
Thank you.
Did anybody have anything else for Lori before we wrap up today's meeting?
I actually have one more question, if that's okay.
Yeah.
I hear Danita. I'm like, I know that
Yes,
voice.
that was me.
There you are. There you are.
My question is, it seems like there could be a shortage in your accounting department. Is there
In our
some?
accounting?
Yeah.
No, actually, there isn't anybody in the accounting that isn't vaccinated.
No, I mean vaccinated. I mean, see, no, I mean, as far as it seems to be, maybe I'm trying to figure out what the backlog of how some families are getting, trying to get, let's say, budgets or what have you. I'm wondering if there's a staff shortage, and that could be creating the challenge in not following, like staying in the guidelines of kind of what you guys came up with in regards to the days of how many things takes as far as with getting into STP. So I guess my question is, if there is, or is there any talk about how we could collaborate, or how the Alta Regional can better see how they could stay within the, and we know that it was just, I know, Lori, it was just kind of a, when we first talked about it, was like a kind of pilot thing, but it truly is far off from kind of what was discussed in our STP. So just curious if there's any means to see what the challenges are, or if you could.
Yeah, no, I can promise you, I hear what you're saying, and it's being looked at. I have to, let me just say, I'm not in the weeds with it anymore, but I can assure you that Michelle and Jen and Tracy and Johnny all are. And managers. And so they are working, looking at figuring out ways to do things better, different. They are recognizing that timeline is not being met. They have made some modifications, and they've given the managers a lot more training and the opportunities to get that a budget in place before they send it off to accounting, so that it's not going to accounting and then accounting has a question because there's something not there, and then it goes back, and then that creates a lag, a time. So the managers are filling out the documents and getting it all complete before they send it to our accounting department, which then it's much more streamlined. As we start to see more numbers coming through, we're seeing that we're needing to beef up in some areas, and I know that Iqbal, our CFO, is certainly managing and looking at what that is required. Additionally, in budget, there were a few positions that we're in process of bringing on, and that is the participant choice specialists. And these are individuals that are going to be specialists in SDP and the onboarding and transition from traditional services to that program, and all of the steps along the way. And they're going to be not case carrying individuals. These are going to be consultants that are going to be helping at the planning team level to move things along a little bit more quickly. That's division. The department has designated that we'll get 3 of these positions, but they've only allocated right now in this part of the fiscal year 2 positions. And we're in the process of making sure we clearly understand what the job description, the guidelines are from the department, And then we're going to go through the process of hiring. And of course, we'll have to make sure that we also train really intently so that those individuals are able to participate as a consultant and not require additional training themselves. So it's in the process, and we're hoping that that will help too. Additionally, we've heard some FMSs that aren't doing the spending plans anymore, at least one, and possibly two, that said it's not in regulation, so we're not going to do that anymore. It takes up too much time. So that means it gets kicked back down to us, which is going to be another wrinkle. And we're going to have to figure that out. We're already trying to figure out different ways to get that done. And one of the areas that we're going to have these participant choice specialists concentrate on is on those spending plans as well, if it's going to be the responsibility of regional centers, whereas at the beginning we did not believe that it would be, because the FMSs had embraced that as one of their components of responsibilities. So yeah, I mean, it's just one of those things, Benita.
Yeah.
We just we feel like we take a couple steps ahead and then we get a few steps back. And so it's gonna take some time to get our cadence, to get in front of this. But I know we will. And again, I appreciate the feedback from people. We hear you, and we're doing everything we can to try and modify the process so that it's a lot quicker for people, and people aren't feeling that, I know that there are some people who are under the impression that we're purposefully, hesitating in the process, and that is not the case. I can promise you that. We're just trying to figure out how to make it go more smoothly. And
Joyce
we've had
another question for you.
Yeah. I just want to make a comment about the revamping of the IT system throughout the state.
Oh,
we
yes.
have funds, and I sort of think that some of the barriers that we've experienced with the counting will be, mitigated by these, updating of all of the accounting systems as well. And you can tell me if I'm correct.
Well, I mean, yes and no. So the issues, I mean, yes, we need to have the UFA system completely overhauled. I mean, it is a long time coming, and every regional center, as well as every provider that is contingent on and reliant upon our funding, is really happy to know that that will be revamped and much more efficient and more operational going forward.
Mm-hmm.
The issues that we've been having with funding on the SDP piece, though, have not, we have really, when we get a complaint, we dig deep. We look at all areas, and honestly, the last several that have come through that have been delays have not been at the hands of the regional center. It has been issues that had to be mediated through the FMS. And so we're really working with our FMS as a result of understanding that there's been some hiccups there, to make sure that their systems are really, smoothly in place, and to really understand what their timeline expectations are of themselves, so that we again can get in front of it and remedy it. But we've had to work really hard, and there's been some points of frustration for some of the participants who are wanting to get to the other side, or had gotten there, but their billing wasn't set up. And anyways, we're learning as we go the conversations that need to happen with FMS as well.
Okay. Thank you.
Mm-hmm.
Chris has her hand raised.
Hi, Chris.
Hi, Lori. Okay, I've got a quick question. It was probably about 3 years back, and you guys were in the process of building a dental clinic.
Oh, I know, right?
And I think John Decker was involved. You guys broke ground, and so I was just kind of wondering the status on it.
So I appreciate you asking, because it has been one of the longest projects on record. Like, we have not ever awarded money on an RFP and had the number of delays that have occurred. I am delighted to tell you, if you were to go down El Camino right now, right before you would hit the juncture, the intersection of Del Paso Boulevard, you will find a beautifully constructed dental clinic that is ready to be opened. All that they are waiting for is the last electrical okay from the county. that they can open. They have trained staff, they've hired staff. So just waiting for those permits to be finally signed off on is where they are at. There were some issues with some electrical stuff that didn't pass on the first go round, or we would have been open in August. But here we are in the mid of October and we're still waiting, but that is it. That is literally it, and they will swing those doors open. Yeah, it's a federally qualified dental clinic, so they'll have rates that exceed that of Medi-Cal. So specialized chairs, specialized training. They'll do chair dentistry, so sedation dentistry, not general anesthesia, but they're very comfortable and confident that most of our clients that require general anesthesia, not all, but most, will be able to be served with chair dentistry and sedation, and behaviorists that are there to help.
Very nice. So it will be open up to all counties.
Yeah, with a federally qualified, it's anybody and everybody, and honestly, it'll be even our sister centers that are going to want to utilize some of the services because they're so specialized. So we're really excited. It's not it's not specifically just segregated for our clients, people with developmental disabilities. It's for the community because there are a lot of opportunities for individuals to get that specialized service, dental service. So it's really my hope in November at our next board meeting that I am able to say, I'm not telling you it's coming, I'm telling you it's here. That's my hope. But I really thought that would happen in September. It didn't.
But it's happened. It's happened. So that's great to know.
I mean, we're on the eve, like we're just waiting.
Good. Thank you.
All right. You're very welcome. Thanks for that question.
Thank you, Lori. Next item on the agenda is just an opportunity for RAC members to make suggestions for future meeting topics or guests. Does anybody have a program that you would like us to spotlight in the future, or agency you would like us to invite? If you don't